Local woman considers herself certainly lucky to be alive this morning. She has survived two potentially life-threatening giant brain aneurysms, and she can thank certainly the doctors at Baptist Health using new technology. It's called the Pipeline Flex Embolization Device. That minimally invasive procedure is basically designed to help treat large aneurysms. This is a picture of how it's used, and we're going to find out how it works. First, joining me now is Rhonda Baker. She's the patient, and Dr. Ricardo Hanel, who is the director of the Baptist Neurological Institute, with more on this procedure. Good morning to you, Doc. It's always good to see you.
Good morning.
So Rhonda, let's start with you first of all. You did have, because sometimes aneurysms can occur without any symptoms, but you did have a symptom,
Yes.
but you did not associate it, obviously, with a brain aneurysm.
No.
What happened?
Started having problems with my vision. And so when I went to my primary care doctor, I let her know that I was having problems with my vision. So she said, well, I'm going to schedule you to have an MRI, which I did. And I brought the disc back to her. So she said, you need to come into the office because the MRI is showing where you had 2 aneurysms. So then she said, well, I'm going to refer you to a neurologist, which I went to Dr. Hanel.
What was your reaction to hear that, though? Because, you know, you hear about brain aneurysms bursting, and you have no time.
No. Well, I said, just tell me what I need to do. And so I got an appointment with Dr. Hanel, and he took it from there.
So the vision, because I see that you're wearing glasses. So were you wearing glasses at the time? Where then you weren't.
No, ma'am.
So was it blurry all the time, or just in the morning,
Just
at night?
sometimes. Sometimes, like when I get up in the morning, it would be blurry, and then it'll clear up later, and then might get blurry again. So.
Wow, is this typical then, Doc?
First, thanks for having us here.
Always good to see you.
I think it's a great time of the year to be thankful for great things like what happened to Miss Baker. Miss Baker's aneurysm was so big that it was putting pressure on the nerve for the left eye. So that's why she was having trouble with the vision. It was a massive size of an aneurysm, bigger than an inch in size. That's what we call a giant aneurysm, was putting pressure on that nerve, and that's why she was having the symptoms. So we see that, it's not uncommon to see that.
What other symptoms are there? And I know we're talking about very large aneurysms, but and obviously the symptoms would be different for a large aneurysm as opposed to a small one? Yes,
correct. Large aneurysms, to begin with, they're much more prone for bleeding. The bigger the aneurysm, the more prone for bleeding. So she's very likely that neither bled while not knowing she had the aneurysms. But the bigger aneurysms can put pressure on the surrounding brain structures. The nerve for the eye can put pressure on a structure called the brainstem, and it can give you people dizziness, trouble with the walking, shuffling, as we call, and so forth and so on. So the larger the aneurysm, the more likely to have this pressure-related type of symptoms. And they also can be headache.
Have that. And now I know, I'm sorry, I didn't mean to interrupt you, but we were talking about the photo, in fact, that you've sent in and showed us how does this work then? Because you think about going into the brain and the aneurysm. I mean, obviously you have to be extremely careful, but is this a fairly new device then that's used?
Yeah, the Pipeline Flex is an evolution of an old technology, 2011. So talking old is 5 years old. The Pipeline Flex is an evolution of that made it easier to use this tool that is kind of a screen that would change the flow on the vessel and eventually cure the aneurysm.
And that is because you're diverting the flow of the blood elsewhere so that it doesn't burst, and then are you able to cut that part out, or it just mends on its own?
No, it stays there and heals. So that once you redirect the flow, the inner lining of the blood vessel will cover the little mesh that you see there on the screen that you saw a second ago. And once you cover that mesh, the blood flow cannot get inside anymore, and the aneurysm is healed.
And Doc, just finally also, I know that we both know Sofia Gutierrez, a young girl who died of an aneurysm, and she is near and dear to our heart. I know her mother probably is watching this morning, and she does every morning. The reality is aneurysms can happen in rarely though, but do happen in children as well as in adults. Is there something that the community should know? Because I was surprised when I saw the statistic 1 out of 50.
Yes, and the statistics on American Heart, 1 in 50, it's optimistic. It actually could be higher than that. 6 to 12 million people in the United States walk around with brain aneurysms. So stay away from cigarettes. Cigarettes not only gives you aneurysms, they also make aneurysms more prone for bleeding. And one thing that we've been talking a lot around is that if you have somebody in the family, Miss Rhonda with her family, a history, you got to be aware that an aneurysm can happen in families, and once you find out before it bleeds, Miss Rhonda is living well, after surgery for that, it can be fixed, and the treatment never been so good as in 2016.
Don't ignore the symptoms, right?
Oh, no.
Don't ignore the symptoms.
That's
They're not
it.
going to go away. They're there for a reason. Thank you. I'm glad
Yes.
that you're doing well. You look
Yes.
fantastic.
Thank
you
you.
for sharing your story
Thank
with
you.
us. I do appreciate it. Doc, always good to see you.
Thank you.
So we will post this entire interview, by the way, later this morning on the morning show page of news4jax.com. We'll be